questions as well. So without further ado, we'll be getting started now. Secretary McCaw, go ahead.
Great. Good morning, and thank you very much for joining us today for an overview of Governor Ned Lamont's plan for the American Rescue Plan Act funds. The theme of the governor's vision is a roadmap for a transformative, equitable, and healthy recovery for our state. So first, just a quick overview of the bill that passed in Washington. Connecticut's share of the coronavirus state fiscal recovery fund is estimated at $2.6 billion. These funds are available for about 3.5 years through December 31st, 2024. We have not received official guidance from the U.S. Department of Treasury pertaining to the use of these funds. However, based on the bill language, we are aware that the allowable uses include expenses associated with responding to the COVID-19 public health emergency or its negative impacts, economic impacts thereof, whether that's a household, small businesses, nonprofits, or impacted industries such as tourism, travel, and hospitality, to support workers performing essential functions during the pandemic through premium pay, for example, and also for the provision of government services to the extent that there is a reduction in revenue that was experienced by the state. The language also allows investments in water, sewer, or broadband infrastructure. Based on the language that passed, there is explicit language that will not allow the fund to be used for deposits into any pension funds or to directly or indirectly offset a reduction in tax revenue resulting from a change in law. The language here obviously will require some interpretation by U.S. Treasury, and the plan before you today takes the available language into consideration pending further details. Governor Lamont's vision for this significant infusion of resources in the state of Connecticut focuses on making a transformative, equitable, and healthy recovery for our state. And there are essentially 5 pillars to this plan. First, consistent with the governor's budget address, defeating COVID-19 is of primary importance because at this point, without doing so, nothing else matters. We have to put this pandemic behind us. And so he does this by addressing the public health impacts of COVID-19 so families can thrive. 2, investing in our future. That is reflected in his plan through upgrades and investments in our cities and towns, through infrastructure, expanded home visiting, modernizing how our residents access benefits, and continued support for broadband expansion. Our private providers are also a portion of the governor's plan, as well as how we provide additional criminal justice supports throughout the system. The third pillar is creating a more affordable Connecticut, starting with the lens of the youngest members of our society. The governor focuses on early childhood needs that have resulted from the pandemic, as well as the entire K-12 spectrum in our elementary and secondary education system, along with our higher education system and the needs of students and families during this time. This also delves into the mental health impacts of COVID-19. Fourth, an economic growth that works for all. The governor's proposal addresses the economic impacts by focusing on restoring jobs, rebuilding our economy, and returning to growth. Heavy investment in workforce development needs. And finally, in terms of modernizing state government, we learned throughout this pandemic the critical importance of continuing to invest in systems so that when residents have needs, they can access the benefits that we are investing in the most efficient manner. So continued focus on modernizing our infrastructure and modernizing our data systems to support effectively navigating a pandemic. I must emphasize that equity is at the heart of Connecticut's strategic investments for the ARPA funds, and each policy area that we will go through has been evaluated through an equity lens. The pandemic has had a disproportionate impact on our most vulnerable residents, minorities, and particularly women of color who've held high-risk essential positions. They're on the front line, and they've felt the impacts of COVID-19, whether it's financially or in their homes or with their children. And so every initiative has been designed with equity at its core and how we can utilize these funds in a transformative way to ensure we have programming that will be most effective particularly for our vulnerable populations. One example includes the expansion of the Universal Home Visits program for Connecticut families to ensure that we have support in the homes for our most youngest children in society beginning at birth. Capital investments throughout this plan focus on prioritizing low-income residents and communities. Investments in broadband to close the digital divide to ensure that all families can access education supports, employment supports, telehealth. All of these areas, it was very clear we struggled with ensuring access to all members of our society because of the need to invest in broadband. Our small business initiative prioritizes funding for minority, women-owned, individuals with disabilities, and veteran-owned businesses. We propose to invest in the public health crisis, again, putting resources in the communities that have been disproportionately impacted. The governor proposes expanding the Office of Health Equity, modernizing our systems, continued supports in higher education, and throughout our entire spectrum, from the youngest of our society all the way up to the most senior. Connecticut's investments that have come through the ARPA are well over $6 billion. Some of these investments come directly to the state for allocation, and as you can see on the top portion of this table, over $3.3 billion is directly coming to the state government to provide transformative investments throughout the state. Our plan will focus on the braiding of these resources to be most impactful throughout our state. The State Fiscal Relief Fund totals $2.6 billion, along with the Capital Projects Fund, which totals $141.5 million. We have put together a complement of programs that also draws upon education funding that goes to the State Department of Education and various childcare grants and stabilization funds that would go to our Office of Early Childhood, as well as mental health and substance abuse grants that would be provided to the Department of Mental Health and Addiction Services. I would be remiss to not mention $1.6 billion of funding that will go to our local municipalities for their investment, as well as close to $1 billion to our school districts to support the recovery of our students and their educational experience. And so throughout this presentation, you will hear of opportunities for the districts and the municipalities to partner in the governor's vision towards transforming and recovering stronger. An overview of the $2.6 billion in state fiscal recovery funds. The plan that the governor will submit today, according to the state law, does require us to focus in on recommending an allocation plan for the $2.6 billion. And as you can see here on this slide, the funding has been allocated according to major policy areas. First, as a reminder, the governor's budget did include an assumption that $1.75 billion of the anticipated federal relief would be used to help balance the budget over the upcoming biennium, and therefore his plan consistently allocates those or reserves those funds under the government services line item. After allocating the $1.75 billion for our supporting the existing state operations in the general fund, that leaves about $897.5 million remaining towards policy areas. And as you can see, we propose a $15 million investment in criminal justice, $10.8 million in early childhood. This is combined with over $300 million of direct funds that are going to OEC. $161 million in economic recovery, $96 million for higher education, $22 million for K-12, coupled with close to $50 million in admin funds that will go to the Department of Education, $31 million for mental health, $50 million for our private providers, over $90 million of investments in public health, a small reserve of $25 million, state operations to continue our pandemic response and to support our employees, $50 million, our testing program and workforce development. Let's talk a little bit more about what this means in terms of the policies. In the next two slides, we will spend less time on the numbers. We can get back to that. Let's talk about how these investments will be meaningful for the state of Connecticut. So first, starting with our youngest and most vulnerable portion of our society. First, the governor focuses on early childhood supports and making early investments in our youth to help strengthen Connecticut families. Research shows that when you make investments early, it actually saves in the long run in terms of supports that you can avoid needing if we can provide meet the needs of the families earlier on. So first, the governor proposes to provide relief to over 17,000 lower and middle income children and their families by covering the cost for parent fees through December of 2021. The governor also proposes to provide free summer school, summer preschool for 3- and 4-year-old children in our state funded centers. So essentially the families would incur no fees to continue their children during the summer, where financial challenges might have warranted have that parent pulling their child out during the summer. The governor's putting the resources in place to ensure that the kids can continue with kindergarten readiness programs. Many of the children missed the preschool experience due to COVID-19. Governor proposes to expand Care for Kids access, to temporarily expand to families earning up to 65% of the state median income, granting access to families of 5,000 additional children. We know that the childcare industry has been significantly impacted by the pandemic, but families need access to childcare in order to return to the workforce. And that leads us into our workforce development early childhood services. We are going to temporarily open up Care for Kids to families that are enrolled in higher education and workforce programs. This will support up to 6,500 children to ensure that access to childcare is not a barrier to their parents participating in our workforce development programs. We also propose to expand Smart Start, offering an additional 900 public preschool spaces at free or very low cost to families, again, focused on helping parents re-enter the workforce. And finally, we propose quality enhancement supports, enhanced payments for centers that are NIAC accredited or NAFCC accredited. Again, an incentive for facilities and providers to improve their level of accreditation, which will result in a more quality experience for our young children, helping to prepare them for school and kindergarten and on success. Our providers also need stability support. We're going to support early childhood infrastructure. 4,000 licensed early childhood programs serve more than 200,000 children. They need help to sustain supply as their revenues have been impacted. A critical component of the governor's plan is to provide universal home visiting for Connecticut's families, to introduce home visiting in areas that have suffered disproportionate impact, stress or child trauma, and to ensure that supports are in the home early on. And finally, to supplement our existing home visiting programs for at-risk families, and just to provide additional resources to ensure that resources are out in the community. We do need to build on the capacity that we currently have to meet needs throughout the state. And as we shift from our youngest children in the state and we move on to kindergarten through 12, obviously many are aware that the elementary and secondary education relief funds, over $1 billion going to our local school districts, will focus significantly on learning loss recovery, providing social and mental health supports, everything that's necessary to prepare our children for success as they return to school full-time in person. And so the governor believes that we need to bridge some of these supports immediately. First, the governor proposes to offer a summer camp scholarship program by allowing children to access sports or specialty camps on a reimbursement basis. The goal here is to ensure that kids who have been isolated through either a hybrid or in-person learning experience or limited in person have an opportunity to re-engage with their peers, to get them out of being in the home and back into an environment where they can thrive and experience some enrichment and prepare them to transition back to continued full-time in-person learning. The governor also proposes to provide free access for children at various attractions in Connecticut through Labor Day, including Mystic and Norwalk Aquariums, the Connecticut Science Center, Mystic Seaport, and the Beardsley Zoo. Again, we want to ensure that finances are not an impediment towards a parent taking their 2 or 3 children to the aquarium to gain an enrichment experience. Again, to build upon what they might have missed out on in school. The governor wants to provide broad access. So we have 5 agreements in place with venues, and we'll be looking to expand to other cultural and museum organizations throughout the state. For our teens, many teens, once they hit 13, they're not participating in a summer camp program, but we recognize that they too need a safe, fun, and healing space for recovering from the past year. And so we're providing resources to support teen programming throughout the state. We also recommend recruiting and training 500 college students statewide to work as mentors for children in summer programs, again, to get the kids re-engaged in the community and supporting our summer camp experience. And finally, additional expansion innovation grants for summer enrichment to ensure that children throughout the state have considerable opportunities. As we shift from our K-12 into higher education, we recognize that our families may have been impacted economically or financially by the COVID pandemic, whether it's through reduced hours on the job or they're fully unemployed. Governor proposes funding additional Roberta Willis needs-based scholarships to, again, provide additional scholarship resources to remove the financial barrier to education. Governor also proposes to enhance retention at the community colleges to support the Guided Pathways advisory model to provide direct support to those children that have greater likelihood to drop out of college or certificate programs. This funding would also include supports for emergency need-based assistance scholarships. The governor proposes doubling support for PACT, the last dollar financial aid, to support thousands of additional children over the coming years. Our institutions of higher ed have also felt the financial brunt of the pandemic through enrollment declines or reductions in meal plan or housing revenues associated with families feeling safer, obviously staying at home and participating in a remote fashion or delaying their education. The governor proposes supports throughout UConn, our CSEU system, our community college system, to help them stabilize as they recover and return to full enrollment. And similarly for UConn Health Center, who's experienced reductions in revenues due to impacted clinical operations during the pandemic. There has been national news and certainly codified here in Connecticut about the impact of the pandemic on the adult mental health system, and that the needs throughout our community have increased. The governor proposes to respond in his plan first by expanding access to mobile crisis response to support the phase-in of 24 access to mobile crisis statewide. Secondly, to fund a diversion center, a regional crisis stabilization center, to reduce the use of emergency departments and inpatient care. We need additional resources throughout the system. Third, to support hospital discharges. Sometimes there's capacity, but there's bottleneck in helping to get individuals to the resources that we have available. So the governor proposes funds to enhance utilization management, to support moving individuals throughout the system to get to the resources they need, as well as scaling up our media campaigns. Now more than ever, is there a great importance to amplify our messaging to let our residents know of the available resources throughout the state to support them during this very difficult time. The governor also proposes to implement a peer support model in our 12 hospitals that have the greatest mental health needs. The peer support, again, would help to transition individuals into community-based settings or other support models to help transition them from the emergency department into resources within the community. And finally, the last component is related to workforce development to help modernize some of our state job specifications and to renew the workforce. We really do need to stimulate greater resources of professionals in this field to meet the needs throughout Connecticut. As we look at our providers of the mental health system, it's also important to expand the racial equity and social justice lens to really look at the lifespan system of care and the extent to which all members of our society can access care and have optimal outcomes. And so the governor supports resources in evaluating the tools that we're providing, the providers that we're working with, and ensuring that we are having equitable outcomes for all members of society. Devices for our DEMAS clients, we learned throughout the pandemic the importance of telehealth, and our clients indicate they like accessing services remotely. And so we believe that we should provide additional support to ensure that they can do so. And finally, we recommend supporting a pilot for access to psychiatric consultation for primary care providers, so that in your primary care office, if they need to immediately tap a resource to give guidance on how to provide services to a patient immediately, so that individual doesn't have to navigate on their own, we'd like to provide that linkage to get to services faster. And then as we stay in the mental health space, our children have additional needs. We had challenges prior to the pandemic with significant use of emergency department for meeting children's mental health needs, and that certainly has been exacerbated. First, we recommend expanding capacity to provide pediatric inpatient psychiatric services. So this would be a 10% rate add-on for those providers that expand their bed capacity while also achieving quality goals. Second, we want to provide supports to help us achieve safe and timely discharges.
Amazing.
Levels of care. If you're not on mute, I kindly ask you to please mute. We propose expanding access to emergency mobile psychiatric services. There are anticipated additional FMAP or Medicaid reimbursement to support this in the out years. We believe that additional behavioral health urgent care centers are necessary at 1 to 2 sites to divert children in the middle of the night if a parent has a critical need and they feel their only option is an emergency department, that we have centers throughout the state that can provide them with some direct care in lieu of the emergency department. Many of our children have experienced urban trauma or violence and racism, and we recognize that there are specific intervention models that can be successful in dealing with these types of challenges. And so resources are provided to support continued study, as well as documentation of evidence showing the success of utilizing these models with our children. They tend to be children, minority children, and we believe that there are other intervention strategies that can be used to help our children heal from those experiences. And now is the time to make an investment to support that model and help to infuse that throughout the system. Continued integration of primary care, similar to what we discussed on the adult mental health side. Workforce development, again, in the area, we need to continue to support expansion. We need more individuals that are in this particular field because the demand is certainly and sometimes exceeding the need. We will continue to look at our programs through the racial equity and justice lens, again, a full systems review and focused on quality outcomes for all members of society. And finally, how residents access our systems and our benefits needs to be streamlined and digitized to improve the experience. Public health is at the core of the governor's plan. First, Connecticut has had a nationally recognized COVID testing program. In fact, this is one of the most significant investments that have been made, over $400 million for approximately 1 year to support our our testing program, whether that's our broad community testing program and our nursing homes, our assisted living facilities, our direct care providers. And we do believe that there's a need to continue supports. The funding plan includes $240 million for COVID testing. We will monitor the need for the frequency of testing or the demand for testing as we continue to monitor vaccine rollout. The plan includes funding to continue that we remain prepared from a PPE and a supplies perspective. Many of our family caregivers have also felt the impact of the pandemic, where their elderly parents or close family members with a disability would have otherwise gone to a day program, but they could not do so due to the COVID protocols. And these families need care themselves, the family caregivers. And we recommend $3 million of respite care for family caregivers to support them with recovering from the pandemic. Our local health departments have been on the front line supporting each and every one of our districts, and they have received considerable funding through direct grants through the Department of Public Health that have been passed through from the federal government, well over $40 million. The governor is proposing an additional $10 million in the allocation plan to supplement the direct funds from the federal government. Building off of the supports that we recommend in early childhood, universal home visiting, recognizing the importance of having individuals that are on the ground understanding the needs of our residents throughout the state. The governor proposes a new community health worker or navigator program that would provide up to 100 trusted community health workers for the 3,000 highest risk families throughout the state to ensure that we have community